So that's my goal for my patients, and hopefully you'll start to think that way too. I'm not saying you'll never take another synthetic drug again. Obviously you will. The goal is to take fewer of them at lower doses. Steroids, generic, cheap, totally covered by insurance, right? And you go into any orthopedic or podiatry or whatever office and you're gonna get offered a steroid injection, right? No questions asked. These, over time, downregulate your normal hormone production, like cortisol and whatnot, so they mess up what's called the hypothalamic pituitary axis, and people on chronic steroids get osteoporotic, they lose muscle mass, they get sicker more often. It's an immune suppressor, right? That's how it works. So it actually shuts off an enzyme that starts the cascade to produce these cytokines, but it also it makes it unable for you to fight off pathogens and bacteria if you use these long term. That increases your overall cortisol level, and we know how damaging that is. And if your cortisol is increased all the time, then your melatonin's messed up, then your sleep cycle's messed up. So steroids are not a great answer long-term either. And then the NSAIDs I told you is an enzymatic reduction. So steroids turn off phospholipase A2. NSAIDs turn off the COX, the cyclooxygenase protein or enzyme, COX-1 and COX-2 or both. And it's a single molecule effect, so it turns on or off an enzyme immediately at a very high level. That's why you feel better right away, as opposed to natural supplements, which take about 60 and 90 days to get incorporated into the system. So you have this single molecule intense mode of action with a rapid onset, but it's doing nothing to reduce those transcription factors I talked about. It's doing nothing to help your mitochondrial function and reduce reactive oxygen species. And it's doing nothing to stop the M1 and M2 imbalance. It's really just turning down one set of prostaglandins to make you feel a little bit better right away. Meanwhile, you get in the cardiac and the GI issues, and it's also slowing down tissue healing. So yes, you can take drugs to reduce inflammation, but I wouldn't recommend it as a lifetime plan.